So in this video, I'm going to show you some tips and hints how to perform very well the Morgan pocket technique to reposition the third eyelid gland and have less recurrences. So I start off my surgery using the blepharospasm to open up wide the eyelids. So this is the ventral part, this is the dorsal part of the eye, and I exposed the eyelid, the interior part of the eyelid, the third eyelid, with those towel clamps, those Bacal's clamps. So keeping traction throughout the surgery, so it's very easier for me to perform my elliptical incisions on the base of the gland and also to do my suture. So this is a very good trick to perform this surgery using those two Bacals here to extend and expose my surgical field. Using a 5/0 absorbable suture, can be PDS or Vicro, I pass the suture from the outside part of the third eyelid to the inside part. So I retract the needle and I leave the suture material there till the end of my incisions. So let's watch it. So okay, this is the first part of the surgery, passing the suture material. And now, extending and causing traction in the third eyelid gland, I perform two elliptical incisions on the base of the gland, on each side here, without connecting the incisions. That way you have a place here and here for the tears to flow out, and you decrease the chances for you to have lacrimal cysts. So always keeping my scissors perpendicular to the gland. Sometimes you have a little bleeding when you cut this big vessel here, but you don't have to worry about that. And now, after creating the two incisions, I'm going to start my suture with a single continuous suture. So this is the first line of suture. Make sure you have a needle with a sharp point and give bites on the edge of your incision. So this is the second pass. You can have an assistant pushing the gland back with a Q-tip, just like that. And you continue your suture to the end. Make sure you avoid passing the needle through the cartilage, the third eyelid gland cartilage. So in this part here, I don't have my incision, so this is the space where the tears are gonna flow out. So after reaching that point here, I invert my needle and I come back with a continuous suture using a Cushing technique. So I pass the needle parallel to my incision, causing and invagination of the edges. So I'm protecting the first row that I did with the conjunctival. And this way I have much more support for the gland to stay in place during the healing process, so I have much less recurrences. Okay, so the gland is back in place. And now I'm gonna pass my needle from the inside to the outside, just by the side of the first impasse. Okay, so this is the first pass of my needle, and I finish my suture right here. And then now I tie my knot. Okay, so the knots are on the outside surface of the third eyelid without having any possibility of rubbing the cornea, causing ulcers. This is very comfortable both for the animal and for the client, because you don't need e-collars at all after the surgery, because as soon as you finish your suture, you finish the knots here and you cut, not leaving a big tag. As soon as you release the tractions that you made with your Bacall's forceps, the third eyelid gland and the third eyelid will be back down here, so the animal cannot have access to the surgical field, so no need for e-collars. So this is the final aspect. You can perform that surgery in 10 to 15 minutes if you train well.